Good day, everyone. Today's topic, local anesthetic agents. So we have studied the basis of pharmacology, the mechanism of drug action, the ways of drug administration into the body, the general concepts, and we have learned what a prescription is. Today we are starting the study special pharmacology. This section examines pharmacological properties of individual groups of drugs. Medicinal substances are classified according to the effects on the body system. The respiratory system, the nervous system, the digestive system, the cardiovascular system, and other. We begin with drugs that act on the nervous system. A drug acts on the nervous system divided into two groups. Substances that affect on the peripheral nervous system and substances that influence on the central nervous system. Peripheral nervous system, the afferent and efferent parts are distinguished. Afferent substance or sensory nerve endings conduct nerve impulses from the organs and tissues to the central nervous system, while efferent sensory nerve endings conduct nerve impulses from the central nervous system to the organs and tissues. Therefore, medicinal substances also divided into that those act on the afferent innervation and that act efferent innervation. Medicinal substances act afferent innervation divided into substances that suppress or inhibit the excitation, sensory nerve endings, and substances that stimulate sensory nerve endings. Substances that act, that suppress the sensory nerve endings include local anesthetics agents. Substances that inhibit the excitation, sensory nerve endings include astringents, enveloping, and absorbing agents. Local anesthetic agents are medicinal substances that reduce or completely eliminate sensitivity, a limited area of the body. This block conduction of the nerve fibers, reversible cardiac loss or conditions. Local anesthetics agents are used for pain relief during minor surgical procedures and dental treatment, diagnostic manipulation, and pain syndrome. The main action in that there is reversible block sodium channels in the membranes of the nerve cells. Once sodium channels are closed, sodium ions cannot cell. Therefore, nerve impulses cannot arise or be transmitted further along the nerve. As a result, the sensitivity in the area where the drug administered decreases or completely disappears. The action of local anesthetics is reversible. After some time, the function of the nerve fibers fully restored. Local anesthetic agents must have high anesthetic activity, act for a sufficiently long period, not be destroyed during sterilization, dissolve well in water, have low toxicity, not be tissues irritated, can restrict blood vessels, and suitable for all types of anesthesia. There are local anesthesia. There are several types of local anesthesia: surface or topical anesthesia, epidural anesthesia, infiltration, spinal, intravenous, and conduction anesthesia. Surface anesthesia used for pain relief, surface tissues and mucous membrane and skin. Infiltration anesthesia is anesthesia during that the anesthetics to injected at the site surgery. Conduction anesthesia, the nerve block, the anesthesia causing the entire innervated area. During spinal anesthesia, the anesthetics is injected into the subarachnoid space. During epidural anesthesia, the anesthetics is injected into the epidural space. Intravenous anesthesia, intravenous regional anesthesia is anesthesia limb by intravenous injection under a tourniquet. Local anesthetics are classified according to the chemical structure into esters. Esters include novocaine, anesthetine, and amides include lidocaine, imicaine, articaine, and bupivacaine. Let's examine them individually and compare. Anesthetine is local anesthetics with moderate anesthetic activity and use it in dermatology, dermatology and dentistry and ENT practice. Dosage form powder for injection solution and ointment and suppositories in combination with other agents. For example, anazole, anestazole, and other. Novocaine is local anesthetics with low anesthetic activity and use it infiltration and conduction anesthesia and dentistry practice. Dosage form injection solution. Lidocaine is local anesthetics with moderate anesthetic activity and use it infiltration, conduction, and epidural anesthesia. Dosage form injection solution and gel. Articaine is strong local anesthetics, widely used in conduction anesthesia and dentistry practice. Dosage form injection solution. Bupivacaine is strong local anesthetics with long-lasting action and used conduction, epidural, and spinal anesthesia. Dosage form injection solution. For compare them toxicity. Novocaine, the least toxic, rapidly metabolite in blood. Anesthetizine, weak, low toxic. Lidocaine, moderate toxic, generally well tolerated at proper dosage. Articaine is strong toxic, but degradation in blood reduce toxic compared to bupivacaine. Bupivacaine mass toxic, cardiotoxicity, neurotoxicity. Local anesthetics is usually used with adrenaline that to enhance their effects and reduce systemic absorption. Constrict blood vessels and slows absorption of the anesthetics and prolongs its action. Not recommended hypersensitivity to adrenaline, high blood pressure, and severe cardiovascular diseases. Of course, we must pay attention of the side effect local anesthetics. Allergy reaction, rash, itching, swelling, toxic reaction, seizures, tremor, systemic reaction, rarely nausea, fainting, vomiting, and local reaction, irritation, inflammation, necrosis, tissues, wound administered incorrectly. Risk factor, high dose, rapid injection, and addition of adrenaline in sensitive patient. At the end, topic should be listed. Contraindication for the local anesthetics. Allergy to the anesthetics, severe cardiovascular diseases, severe kidney diseases, severe liver diseases, high anxiety, seizures disorders, pregnancy, and lactation.